Welcome to Deny, Delay, Depose, Health Over Wealth. And folks, buckle up because it feels like the world is determined to give us plenty to talk about this week, doesn't it?
Yeah, no kidding. It's intense. I mean, you look at the stuff coming out of the Middle East, the strikes, the counterattacks, it's almost biblical in scale.
Intense is one word for it. I'd say it's a calculated move, though. High stakes, definitely, but not without reason.
Calculated maybe, but at what cost? I look at these reports about monumental damage and decade of planning, and I can't help but think about all the resources, the manpower that went into that. What if we put even a fraction of that into fixing our healthcare system? I mean, what if we measured the damage that our system inflicts on human lives, on people's health, instead of just infrastructure?
Okay, but let's be real. These global events and the US healthcare system are connected. It's all part of a bigger game, Jesus. Trump is a martyr in a bigger healthcare narrative.
A martyr? Otto? Come on. He ordered the strikes. It's a geopolitical chess game. There's a balance of power to maintain. Sometimes that requires force.
But is that balance of power really serving us? When people here at home are rationing insulin, when they're delaying treatment because they're afraid of bankruptcy, when they're dying because they can't afford care, what's the point of projecting strength abroad if we're rotting from the inside out?
Exactly. It's a distraction, Sarah. While everyone's focused on Iran, the real war is happening here. The healthcare system is being dismantled piece by piece, and these strikes are part of the play. Mangione was a martyr, Sarah, in a war for a fairer system.
Okay, let's not romanticize violence. Mangione's actions were extreme. And while I agree there are definitely things that need improvement in healthcare, calling it a war, dismantling, that's hyperbole. We have a system that, for all its flaws, provides cutting-edge treatment and innovation. It's not perfect, but give it some credit.
Cutting-edge treatment for those who can afford it. Innovation driven by profit margins. Sarah, how many people are denied coverage every year? How many go bankrupt from medical bills? It's not a war in the literal sense, but the consequences are just as devastating. People are dying, Sarah.
Right, and what about the systemic inequities? The data on incarceration rates and health outcomes? It's not a coincidence. People in marginalized communities are disproportionately affected by both the criminal justice system and the healthcare system. They're trapped.
Okay, I agree that socioeconomic factors play a huge role. No one's denying that. But that's not a healthcare problem, per se. That's a societal problem. You can't just fix it by waving a magic wand and creating universal healthcare. Though, I agree, would be a move in the right direction.
But isn't healthcare intrinsically tied to societal problems? If someone is living in poverty, if they're facing discrimination, if they don't have access to healthy food or safe housing, that directly impacts their health. And if they can't access affordable healthcare to address those issues, the cycle just continues.
Exactly. And that cycle is reinforced by the criminal justice system. Think about it. Someone gets caught up in the system. Even for a minor offense, they lose their job, their housing, their access to resources. Their health deteriorates, and they're even less able to navigate the already complex healthcare system.
That's a valid point. The intersection is definitely there. But how do you untangle it? It's not like you can just magically erase poverty or systemic racism. Those are deeply ingrained issues that require long-term solutions.
Start by acknowledging the problem. Stop treating healthcare as a commodity and start treating it as a human right. Universal healthcare, Medicare for all, whatever you want to call it, we need a system that ensures everyone has access to quality care, regardless of their income or zip code. Then, address the social determinants of health. Invest in education, housing, job training, food security to create a society where everyone has a fair shot at a healthy life.
Yes. And look at other countries. Countries with universal healthcare systems consistently have better health outcomes and lower infant mortality rates than the US. It's not rocket science.
Okay, but those countries also have different demographics, different cultures, different economic systems. You can't just transplant a healthcare system from Sweden to the US and expect it to work perfectly.
No, but we can learn from them. We can adapt their models to fit our own context. The point is we need to be willing to challenge the status quo and consider alternatives. The current system is clearly failing too many people.
And it's failing them in a way that perpetuates inequality. You see it in the data: higher incarceration rates in communities with limited access to healthcare, poorer health outcomes for formerly incarcerated individuals. It's a vicious cycle.
So let's say we implement universal healthcare. How do we address the biases that exist within the system itself? The studies showing that doctors often provide different levels of care based on race or socioeconomic status.
That's where education and training come in. We need to educate healthcare professionals about implicit bias and cultural competency. We need to create a system that is more diverse and representative of the communities it serves. And we need to hold people accountable when they perpetuate those biases.
Right? And we need to address the root causes of those biases. They're not just individual failings, they're a product of systemic racism and inequality.
Okay, so education, training, accountability. What about the cost? Universal healthcare isn't cheap. How do we pay for it?
There are numerous ways to pay for it. We can raise taxes on the wealthy. We can eliminate wasteful spending in the current system. We can negotiate lower drug prices. The truth is, we're already spending more on healthcare per capita than any other developed country. We're just not getting the same results.
Yeah, and think about the economic benefits of a healthier population. People who are healthy are more productive. They're less likely to need government assistance. It's an investment that pays for itself in the long run.
Okay, but even with those measures, there's going to be some disruption. People are going to lose their jobs in the insurance industry. Doctors might see their incomes decrease. How do you mitigate those negative consequences?
Those are legitimate concerns, and we need to address them. We can provide job training and placement services for people who lose their jobs in the insurance industry. We can incentivize doctors to practice in underserved areas. The transition won't be easy, but the long-term benefits far outweigh the short-term costs.
And we need to remember why we're doing this. It's not just about economics, it's about morality. It's about creating a society where everyone has the opportunity to live a healthy and fulfilling life.
I guess I'm just cautious. I've seen too many well-intentioned reforms backfire. Healthcare is so complex, so intertwined with so many different factors. I'm just not convinced that a radical overhaul is the answer.
But decades of incremental change haven't solved the fundamental problems. Costs are still rising, access is still limited, and people are still suffering. Sometimes you need to tear down the old system and build something new.
Exactly. The B-2 bombers, all the military infrastructure, all the money used in those strikes and planning, that same energy should be used to rebuild a system to serve the people, not insurance companies.
But can that money be used in healthcare?
It can and should. Healthcare is a far better investment.
All right, but you need the doctors, you need the engineers, you need a hospital with the beds.
Absolutely, Sarah. It's about having the equipment and the tools, sure. But more than that, it's a shift in mindset. What are we doing with these tools to maximize what matters, people's health?
It's about priorities, Jesus. It's about what we value. We value national security, so we pour trillions into the military. We don't value healthcare, so we let it be run by corporations that prioritize profit above all else.
Okay, but national security is important. You can't just ignore threats from other countries. There's a whole geopolitical landscape to consider.
Of course, it's important, but national security isn't just about bombs and missiles. It's about the health and well-being of our citizens. A sick and impoverished population is a national security threat in itself.
Think about the message it sends, Sarah. We're willing to spend billions to destroy nuclear facilities in another country, but we're not willing to spend enough to ensure that everyone in this country has access to basic healthcare. What does that say about our values?
It says that the world is a complicated place, and there are no easy answers. You have to balance competing priorities. You can't just throw money at every problem and expect it to go away.
But we're not just throwing money at the problem. We're investing in human lives. We're investing in a healthier, more productive society. And we're creating a system that is more just and equitable for everyone.
It's a moral imperative, Sarah. We have to do better. We can't keep accepting a system that leaves so many people behind. Mangione was a product of that.
All right, let's get practical. How do we actually implement these changes? What are the first steps?
First, we need to build public support. We need to educate people about the problems with the current system and the benefits of universal health care. We need to mobilize voters and elect politicians who are committed to change. Like my cousin Nino, he's trying to help out people in Maryland with healthcare.
Yes. And we need to organize, protest, and demand action from our elected officials. We need to make it clear that this is not just a political issue, it's a matter of life and death.
Okay, so grassroots activism. What about policy changes? What specific laws or regulations need to be changed?
We need to pass Medicare for all. We need to expand Medicaid. We need to negotiate lower drug prices. We need to strengthen consumer protections and hold insurance companies accountable. There's a whole laundry list of policies that need to be changed.
And we need to address the social determinants of health. We need to invest in affordable housing, job training, food security, and education. We need to create a society where everyone has the opportunity to thrive.
And all of that costs money. Where is it coming from?
From the trillions of dollars we're currently wasting on a broken system, from the tax breaks we give to the wealthy, from the bloated military budget. We have the resources. We just need to reallocate them.
It's about shifting our priorities. It's about recognizing that healthcare is not a luxury, it's a fundamental human right. And it's time we started acting like it.
Okay, I'm still skeptical, but I'm willing to listen. What are some concrete examples of how this would work in practice? How would it affect the average person?
Imagine a single mother working 2 jobs to make ends meet. She's struggling to afford rent, food, and childcare, and she doesn't have health insurance. Under Medicare for All, she would have access to free, comprehensive health care. She could see a doctor when she needs to, without worrying about the cost. She could get the medication she needs to manage her chronic conditions. She could focus on raising her children and building a better future for herself.
Or imagine someone who's been incarcerated. They've lost their job, their housing, and their access to healthcare. Under a reform system, they would have access to the resources they need to re-enter society successfully. They could get mental health treatment, job training, and assistance finding housing. They could break the cycle of poverty and incarceration.
Okay, those are compelling examples. But what about the people who are happy with their current insurance? What about the people who value choice and competition?
They would still have choices. They could choose their doctor, their hospital, their treatment plan. The only difference is that everyone would have those choices, not just the wealthy. And competition would still exist, but it would be competition based on quality of care, not on profit margins.
Exactly. And the current system isn't really about choice anyway. It's about being forced to choose between your health and your financial security. It's about being denied coverage for pre-existing conditions. It's about being bankrupted by medical bills.
Okay, you've given me a lot to think about. I'm still not entirely convinced, but I'm more open to the idea than I was before. It's a massive undertaking, but maybe it's what we need.
It is a massive undertaking, but it's an undertaking worth fighting for. The health and well-being of our society depends on it. We have to start valuing people over profits and prioritizing healthcare as a fundamental human right.
Amen to that. It's time for a healthcare revolution. It's time to build a system that is truly for the people, by the people.
Well, that's certainly a lot to digest. Thanks for the lively discussion, guys. It's definitely given me a new perspective on the whole issue.
Absolutely, Sarah. It's about a conversation and a shift in how we perceive health. Health is an investment instead of a liability. And thanks to our listeners for tuning in. Keep fighting the good fight. Remember, health over wealth.
Exactly. Stay informed, stay engaged, and stay healthy. Until next time.